We know a lot about viral illnesses these days, much more than we did even a couple of decades ago. But we're still learning about this particular one, and in the meantime, it seems to be a fairly worrisome pandemic. And since it affects older people with illness more severely, the safe thing to do is to self-isolate and take care of yourself at home. Keep your distance from others, including your own family. I know that's difficult because many people in our community are very attached to their children, their grandchildren, their great-grandchildren. But the thing to do these days is to stay connected with them, but on the phone, not in person. I know people get antsy at home. It's okay to walk around the yard or around the block a little bit, but you just want to stay away from groups of people. That's part of self-isolation, is relatively just avoiding contact, staying away from people at least 6 feet or more, regardless of the venue. And why not just get groceries delivered for a couple of months here? Fortunately, that's an option these days. I think for appointments that can be put off comfortably for a couple of months, that's probably a good idea, just to postpone those. And even if you are sick with the symptoms of COVID-19, cough, fever, sneezing, sniffles, those kinds of things, it's probably a good idea to try a virtual visit with your doctor. We do worry about shortness of breath in older people, and we usually want to check them out if that occurs. So most physicians in the community would have a short trigger to have somebody come in and be evaluated, or to send a home team to go evaluate them. If we're younger, we might be relatively asymptomatic. It might be easy for us to transmit the virus to an older person, completely unbeknownst to us. It might be a big deal for those you're around. If it's not a big deal to you, that's okay. But what about the other people for whom it might be a big deal? You need to think about them and recognize they are important. So for their sake, it's a good idea to self-isolate. It's because you care about those around you, it's important to adhere to that pretty strictly. This too will pass, like many things that happen. It is scary. It's okay to be scared and to acknowledge it. That's a good thing to talk about on the phone with family and acknowledge that. But it's also a good time to just count our blessings